The earliest symptoms and signs of HIV infection typically start to appear after about 14 days. This is because it takes that long for the HIV virus to multiply enough to begin damaging the immune system and causing noticeable symptoms. The first symptoms of HIV infection often mimic those of the flu. During this period, you may experience typical flu symptoms such as fever, chills, night sweats, and more. Another early sign is what is known as non-tender lymphadenopathy, which refers to the painless enlargement of the lymph nodes. The lymph nodes are small bean-shaped structures that helps to remove waste from the body. The lymph nodes most commonly affected are those near the waistline and in the neck. If you notice small round swellings in these areas, then you should be concerned. A sore throat can also occur as an early symptom of HIV infection. A rash may appear 2 to 3 days after the onset of fever and can persist for 5 to 8 days. It commonly affects the upper chest, collar region, face, scalp, hands and legs, including the palms. Muscle and joint pains are also common early symptoms. Diarrhea, which is defined as the passage of 3 or more loose or liquid stools per day, can be another early sign of HIV infection. Unintentional weight loss is another symptom that can occur in the early stages of HIV. Frequent headaches can also be an early indication of HIV infection. None of these symptoms are specific to HIV, but if they persist or become prolonged, especially after you've been treated for common flu-like illnesses such as malaria in malaria endemic areas, you should consider the possibility of HIV, particularly if you engaged in unprotected sexual intercourse in 2 weeks prior. Another strong indicator of HIV is the presence of mucocutaneous ulcers or wounds. These ulcers are usually shallow, sharply defined, with a white base surrounded by a reddish area and are commonly found in the mouth, anus, penis, or esophagus. And now, I'd like to talk about opportunistic infections in HIV. Opportunistic infections occur when the immune system is compromised. The immune system, which is designed to fight off infections, is weakened by HIV. As the immune system deteriorates, infections that the body would normally fend off begin to thrive. So basically, they use the opportunity of the reduced immune system to invade the body. One of such opportunistic infections commonly seen in the early stages of HIV is oral and esophageal candidiasis, which appear as whitish patches that can easily be scraped off, typically found at the back of the throat. If you start experiencing symptoms like these that don't respond to treatment, it's important to suspect HIV and seek testing at a hospital. Remember, HIV is not a death sentence. With new advancements and effective medications, it's possible to live a healthy, long life with HIV. So, don't hesitate to start stage treatment and make sure to avoid unsafe sexual practices in the future. If you found this video helpful, please subscribe, will ya? Thanks. Bye.